Hi, I'm Dr. Stan Steindl. Welcome back to Compassion in a T-shirt, where we explore how compassion, when properly understood and applied, can change lives in truly remarkable ways. Today we're diving into a fascinating intersection where psychology meets nutrition with my guest Jennefer Dorban. Jen has spent over a decade working in the UK's NHS talking therapies for anxiety and depression services and now specialises in supporting people with post-COVID syndrome or long COVID. She's an experienced psychological therapist with training in cognitive behavioural therapy, compassion-focused therapy and mindfulness-based interventions. But what makes Jen's work really stand out is her efforts to bridge the gap between psychological and physical health. She's recently trained in nutritional therapy, bringing a personalised and holistic approach to well-being, where food, psychology and compassion all play a role. Today we'll explore how she integrates psychotherapy and nutritional therapy, what her research reveals about nutrition and long COVID, and how the way we nourish ourselves can be an act of deep compassion across the three flows. Let's play it up, and so I bring you Jennefer Dorban. Good, all right, well, Jen Dorban, welcome to Compassion in a T-shirt.
Oh, thank you. It's delightful to be here. Really delightful.
Wonderful to have you. You have a unique combination of expertise, I guess, as
Mhm.
both a psychotherapist and also a nutritional therapist. And so I was interested to explore some of that, first of all, just how perhaps these two areas came together in your work or what led you to kind of explore and integrate them.
Mm. And I've thought very deeply, kind of around this. It's a good. It's so interesting to think back on. Well, how did I end up here? Why am I here? Well, kind of. And it's in some ways. It's. I feel almost surprised that more people aren't here in a way because it feels like such a natural orientation for me. I have always really loved food. We come from a family who's been commented who likes to eat. So it's just that I've really always really enjoyed food, and can be a bit more of a priority. Perhaps sometimes in my earlier life when I'm out with friends and maybe they're not prioritizing food so much, I'm just like, when are we going to eat?
Right, yeah.
So it's always been really important to me. But then I suppose from the perspective of how that came about in my work, I'm now a psychological therapist in the UK National Health Service, the NHS. Um, and I've come through, I like to say this is an old word now, but IAPT born and bred. So I'm one of those clinicians who started out as a psychological wellbeing practitioner, being trained in low intensity CBT. So also known as guided self-help, and part of learning to do assessments for and that's in primary mental health care, so people with mild to moderate anxiety and depression, and so part of that assessment is asking people about caffeine, alcohol, sleep. We use the PHQ-9. I can't remember its full name now. Is it Patient Health Questionnaire 9 or something like that? And one of the questions on there is about appetite.
Mm,
So these
yeah.
nudges, they're there, they're already there. And I think it just seems as though perhaps I picked that up a little bit more strongly, maybe, than that's just something that really spoke to me. Um, and I think that a sort of, kind of cognitive behavioral therapy, cognizant, there's the work on how we think about things and what we do, behaviors, how we behave in the world, the choices that we make, the urges that we have, do we roll with them, do we go, against them potentially? And I think that we notice, I certainly noticed starting to work, kind of in CBT informed practices, that it can be a lot easier to make a choice to choose to behave differently. And that argument in deciding to set up a different behavior is a lot easier than changing one's thinking. That's a lot harder and it requires a
Mm,
lot of cognitive work to do that. So when you're going for that sort of low hanging fruit, kind of those quick wins, we become therapists because we're moved by the suffering that humans experience, that people experience, and we want to help alleviate it. So I think, kind of when already starting to think about, well, what's your caffeine intake like? How's that affecting your sleep? What's your alcohol intake like? It's not a big leap then to think, well, and how are you eating? You told me your appetite is poor. How does that show up? And it really took me by surprise, I think, especially someone, as I said, so motivated by food, to notice how many people I was working with have one main meal a day. And that might be later in the evening as well, probably, kind of a 7 p.m. onwards. And then they're skipping meals, or they're just cruising along, supplementing their hunger with either coffee, tea, and nicotine, and maybe a biscuit or a piece of toast. So if you're thinking, well, where's the nourishment in there? And I think it really fits with the biopsychosocial model that we work with in CBT. And CBT does the psychosocial really very well. We're thinking about their environment and the people around and the influence of that. We're thinking about the psychological processes internally. And we think a bit about the biological processes, thinking about how emotions, and in panic disorder, how's my heart rate going? And, that butterflies in the stomach and anxiety. But I wonder also then about the biochemistry aspect in the biopsychosocial model. And we're constantly influencing that through our choices that we make in terms of what we eat and what we drink, which was already kind of there a little bit with that appetite, caffeine, alcohol. And then I practice as a bit of a prop. My favourite, I found, activity diary when doing behavioural activation as a step 2, and I would still use it now, is one made by Mood Juice. Am I okay to just throw this? I'm going to show it in front of the camera, if that's
great.
okay.
Yeah.
There we go. So I really, really liked this one. It's not got too many lines across it. I think some of the other ones I can find quite overwhelming when they're in hour bits. But they've got breakfast, lunch, and dinner rows on here. So that one I think just really spoke to me, and I started quite naturally using it. And so it then, when you're looking at that activity scheduling, how do I regulate my day and my week, and where I put what's my best time of day and what's my worst time of day? How do I rest? How am I nourishing myself? How am I setting myself up with a day? Do I eat breakfast? Do I eat a lunch? Do I eat a dinner? So that structure, when we're trying to restructure a rhythm in the context of depression, it's just kind of was there. So then I started listening to more podcasts on nutrition and biochemistry. The field is deep, broad and deep, of all kinds of people who've got ideas about nutrition. It's in that health, the well-being sphere. And so I started listening to some of that and getting really curious about it. But it wasn't until more recently. So I carried on to do my CBT training. That was the clear career pathway for me. Got my CBT qualification, and then took a little bit of time, because that's quite intensive training. And then when I was ready, progressed to, I've done a master's in nutrition, called Nutrition Science and Practice, with the Northern College of Acupuncture, and relatively recently finished. So the research that we're going to talk about today, I finished it just under a year ago, and graduated last November.
Congratulations. That's good news.
Thank you very much. Yeah.
I love how you started with, you're a bit of a foodie, I guess, is one of the things. You enjoy the social side of it, you enjoy the food itself. I just want to give a little shout out to your t-shirt, because it says,
thank you very much.
Sprouts are for life, not just for Christmas.
Christmas.
which is
fantastic phrase.
Which is designed by a dear friend of yours, apparently, and so we'll actually put a link to that Etsy shop in the description below, just for fun, if anyone's interested. But yeah, there is that that sort of part of you that has a real sort of organic interest and even passion in that area, and you just stumbled across the fact that it's kind of in there, isn't it? Even
Yeah,
in the area of mental health, it's in there in some ways from the point of view of how appetite or diet and so on can be a consequence of, for example, depression. People might start to lose their appetite and what that means and how that might be a part of our formulation and so on. But also in the other direction as well, that food does seem to play a really important role in the kind of the ups and downs of one's mental state or emotional
yeah,
state, and that in some ways, yes, there's this sort of bidirectional reciprocal thing. When we might feel depressed, we might be a bit off our food, but when we're off our food,
yeah,
we're only having well, we're not having the kind of diet that really helps to nourish us and maintain a
yeah.
mental health. So it's kind of really in there, and you've
Mm.
developed a kind of a parallel thing. Do you find yourself really thinking nutritionally with most or all people, or do you
Mm.
sort of notice that there are certain times when you decide to work nutritionally and incorporate more of that alongside the psychological therapy? How do you make those kinds of decisions?
Yeah, really great question. I think partly I'm conscious that my main practice at the moment is still in an NHS talking therapy service. So I'm really conscious that my job there is to be a psychotherapist, and I never stop doing that. And so then my um, so that's what I'm always turning up for clients. But yeah, I think different people, it's whether if it's there, then I might lean into it. And I think all of us, probably as therapists, we've all got our little niches that we're particularly interested in, and the things that we see, and what we might lean into a little bit more than others. But yes, only really if it shows up. So thinking about some recent clients where it has shown up.
Mm, mm,
I have been working with someone who, I suppose I should also say, I work with in a service specifically for people with long COVID. So that's all my patient group at the moment. Um, and one person was particularly struggling with their sleep. And there's lots of things in affecting their sleep. But one of the things that we noticed was that she was only drinking Diet Coke. That was her only form of hydration. And I could go have an argument about how hydrating Diet Coke is for the body. But also, Diet Coke has caffeine in it. And if you're only drinking Diet Coke throughout the day and then you're having trouble sleeping, then that's going to have an impact on your sleep. So one of the things that I did with that client is talked with her about that, offering up that psychoeducation, and that reason for doing this perhaps tricky thing that she might not really have wanted to do very much, but cutting down that caffeine intake and switching out her Diet Coke. What else can she switch it out for? What would she like? And I think we cut it down by half. So and that's
right.
where, which is great.
Yes.
Kind of I was really pleased with that. Um, I would love to be curious for her about what it might be like for her to cut it out completely for a little while. I've certainly done caffeine holidays myself. I've got a coffee here today, by the way, so I'm not, a purist by
You're
health
sprung.
food by any means. Yeah, exactly. But it is interesting every now and again to
Yeah.
take a bit of a caffeine holiday. But she wasn't ready for that, so I'm not going to push for it. That's where she got to. I'm going to take that win, and we did some other sleep hygiene along it. Um, I've got someone else as well who I'm currently working with, where the hydration nutrition is really very prominent. It's forefront and center in a way in what we're doing. It's a person who has diabetes and is also depressed. So they're in this really tricky place where very low motivation. They've also got long COVID, so they've got fatigue and brain fog, and food, nourishing oneself is hard. It requires motivation, it requires planning, it requires perhaps sometimes eating something, even if you don't necessarily, it's not the thing you really want to eat in that moment, but knowing that it's going to nourish you and maybe noticing that how that feels afterwards. And so this person is stuck a little bit in not being motivated, tiding themselves over with tea and biscuits. Because they are quite hungry, they're eating most of a packet of biscuits, and it's like, well, there's no point leaving two in the pack, so I might as well just finish them off. So not being hungry then for any other kind of actual nutrition, and then having these blood sugar spikes. So one of the first things that we did together was again tied in the sofa with cups of tea, caffeine, and milkiness in the tea is an appetite suppressant, so we're not going to feel hungry. So I negotiated with him that could he have a 500 milliliter bottle of water. And we talked about if you don't like water, make yourself up a squash. You can, and then you're in control of how much flavoring is in it. And maybe you can wean, if once you've got to something that you like, you can tone it down. You can kind of wean yourself off it a little bit. Anyway, he was actually quite happy to go with water. He's now sipping a litre of water a day. And when he started off doing that, he said, I noticed how much more energy that I felt just by being better hydrated. So now we're building on that with, right, okay, let's address this low motivation around food. Let's recognize that planning meals is hard. When you wait until you're really hungry and you've got brain fog, and then you've got to think about what am I going to eat? What preparation does it require? Of course, you're going to reach for the biscuits, for the easy food, the quick sugar hit, the fat hit, the satisfaction, and the soothing. Yeah, sweet foods, if eating is a soothing activity. So that's where we're at the moment is, right, okay, how can we plan this? What can I plan where food that I like but also nourishes me back? Because his cake and biscuits aren't nourishing him back.
Yeah. You allude to things like, I suppose, readiness to change, or really that this is a lot of this is about behaviour change in a sense, isn't it? And one of my kind of other big interests is motivational interviewing and trying to help people change, and some of the usual suspects: drinking, smoking, diet, exercise, or and definitely dietary kind of nutritional sorts of behaviors are in the mix. How do you find people respond, I suppose, to these elements of treatment? Because they are tough. They're changes, and behavior change is difficult, and there are mixed feelings quite often, aren't there, in terms of, oh well, this, I really enjoy my sweet biscuits, and I whatever it might be. So how do you find people responding to this combination of treatment?
I think generally, again, I think it's one of the things about coming across it is I don't come across it in a purist way. So I'm not kind of saying you have to do this, and it's really being very collaborative and finding where they want to change. You take this person, the chap with diabetes, for example. He was saying, I know this is bad for me. I've gained weight. I feel sad about that. So I had been losing weight and feeling good about that. And he's got cognitions like, I know I shouldn't be doing this, which from our, kind of in our CFT minds are going, oh yes, self-criticism.
That's what was in my mind.
Feeling guilty, feeling hopeless, which is maintaining the cycle. So, as we do, I just kind of reflected that cycle back to him, and in that kind of motivational interviewing kind of way, appealing to, this is something that you want to change. You're really noticing how this isn't serving you. Let's think about, why, and the reasons to change, why you want to change, and I only did this yesterday and it's fallen out of my mind, but there were reasons to change as well, that he was feeling improved from eating in a slightly different way before, but potentially going at it when we want to lose weight, we kind of want to lose it yesterday, and we maybe come at it in quite an aggressive way, and it feels like we have to feel hungry all the time, and it's pretty miserable, and this is why restrictive diets don't work. So it's thinking, right, okay, well, that's something you want to do, so how can we do that in a way that does work? And he said, he's like, oh, I know sometimes I'm not even hungry, but I eat biscuits anyway, because they're sweet, and I like the after flavour in my mouth after eating them. So I'm really hearing that and saying, right, okay, you like sweet stuff. So I wonder what might be some appealing changes. Have you tried dried fruit, for example? Kind of it's. And I think I started off with any fruit, but then think about dried fruit, things like dried apricots, dried mango, dried apple. Kind of these are whole foods that have all the nutrition of the fruit in them, much more nutritiously dense than your biscuits and your cakes, your kind of ultra processed foods, really. But also has that sweetness, is maybe potentially scratching that itch, and it becomes a behavioural experiment. Then it's not. I'm not saying this is going to change your life and that's how it's going to be, but approaching all of these changes in that behavioural experiment way. Does this feel like something you'd like to change? These are the reasons to do it. Let's give it a try. See how you feel.
Yeah. I love it. I can hear the change talk. You're evoking the
Yeah.
change talk, the desire, reasons, need, and ability, and really helping the person to formulate a bit of a plan from there. It really the nutritional choices really can be quite profound acts of self-compassion.
Yeah.
We might come back to that though, actually, a bit later,
Mm-hmm.
because I
Yeah.
did want to actually just get into a little bit of your work and research
Mm-hmm.
around long
Yeah.
COVID. You mentioned
Mm-hmm.
that you're really working in that area, and
Mm-hmm.
you recently did your thesis, master's research on that. Could you just give me a bit of a sense of how we're thinking about long COVID at the moment in terms of
Mm-hmm.
kind of definitions or diagnostically?
What's the short answer that comes to mind? Kind of is a little bit we don't know,
Yeah.
which isn't a particularly hopeful message, is it? So the definition in NICE guidelines that so coming very much from a UK centric perspective, but across, kind of, I did look at the definitions, kind of the US definitions and World Health Organization, and they do pretty much agree that long COVID, and long COVID is the term came up by the people experiencing it. That's the clinical population's word. And I think, I wanted to really honour that by using that word in my research. But it can also be called post-COVID condition, post-COVID syndrome, um, and in NICE guidelines, what we're recognising, and the NICE calls it post-COVID syndrome, which is when symptoms after an acute infection of COVID-19, symptoms persist for longer than 12 weeks, and or it can activate new symptoms that are prompted even in that post-acute recovery period, seem to start after COVID-19 and then continue to persist. So it's a long-term health condition that then, kind of asks people to adjust and manage in a long-term way.
Mm.
And some people, there's a real breadth of clinical population, because you've got the clinical population who were extremely unwell, hospitalization, in a coma kind of level, unwell. And of course that their bodies have been quite ravaged by the COVID-19 virus. And there are consequences that we can see and measure, which is, kind of lung scarring, for example, or, and we know that the COVID-19 virus is airborne. It gets into the body through the airways, but then the virus travels to different parts of the body. We know that it shows up in the gut. We know it's significantly affecting people's kidneys. And there's a whole host. I think there's something like, kind of 260 symptoms that have been associated with long COVID. It's just huge.
Mm.
Because then the other side of the spectrum is those people who might have even had a mild infection, like the acute part of the infection might not have been that drastic, but then just never really quite recovered. That fatigue has continued, the brain fog has continued, and it really affects people's felt sense of their ability to be themselves in the world, because they can't quite do things in the same way, or they get tired more quickly, so they have to kind of come home and rest a bit more. And so some people, maybe on that more milder end, for want of a better word, some people are just about managing their life, but but not super happily and feeling pretty rotten whilst they're doing it. And we have seen some people recover. Some people do, but that recovery journey is a lot longer than expected. It's a recovery that we kind of notice in might notice in, kind of months and years rather than days and months, that what we might expect from the recovery from a normal cold. Sometimes, certainly I remember having a common cold, and I can, have a persistent cough perhaps for a good few weeks afterwards, but then after a good few weeks it does resolve and it goes away and I feel my normal self again. Well, people don't feel like that in long COVID. And so some people do recover and some people don't. And I don't think we really know exactly why. And we're still trying to figure that out. What's really hard from a research and clinical perspective with long COVID is this very broad population. So how do we define it? And then what do we target? And there's lots of different hypotheses. I've mentioned already, kind of the scarring effect, the changes, kind of the insults to the body directly that the virus might have had, and those are easy to identify. But why do people keep having symptoms? Is it because the virus is still there, but not in a way that it's acute enough to have acute infection, but the body, the immune system is still responding to it? Maybe that's one hypothesis. Maybe it's that there's pieces of the virus, so it's not active or being a menace in the body actively, but there's still a foreign body in the body that the body goes, this isn't me, and I'm going to mount an immune response to it. Or maybe it just switches some things on and off that doesn't work quite so well. So people who might have been, I've worked with people who might have been maybe pre-diabetic, and then it's tipped them over into diabetes. It seems to have potentially an impact on how the body manages its blood sugar and energy. So, kind of it can be really potentially right down into that biochemical molecular place. And we're just not really sure yet, which makes it really hard.
And dare I say that sort of nutritional place, I suppose, too.
Yes.
In a way, but the fatigue and the brain fog, those sound like that I've been sort of heard about those from people before. Just the way that those two ongoing experiences or symptoms really do create all sorts of difficulties to live one's life as one used to or would want to, and very kind of painful and a lot of suffering really that goes along with those two bits. You did a systematic qualitative review then.
Yes, I did. Yeah.
Exploring the nutritional interventions. And for long COVID. Just give us a bit of an overview maybe of perhaps what the study entailed and what you were hoping to achieve or hoping to learn from the study.
So my methodology was it's quite a niche one, because I was coming at it. I was trying to. The original intention was to do a case study, like much of my cohort, and for reasons that became not available to me. But I still really wanted to do it in long COVID. Wanted to make long COVID the focus, and it's we've only been researching it really. We've been aware of long COVID since 2021. If COVID started in 2020, it was only really kind of 2021 that we started noticing some people aren't recovering. And what's this about? And it was the patients that were like, hey, listen to us. And, and the medics experiencing it going, hang on, other medics, you need to pay attention to this. I'm experiencing this. And I'm not saying it's not in my head and I'm not making it up, because it can be, it's quite unfortunate. It can be because it's a medically unexplained, kind of thing, a bit like CFSME and MS and their story, kind of there's a lot of dismissing and invalidating in the early days. And I know people still experience that today. So the question was, well, what do we know? Who's doing what research? What is out there? So I did this literature review, and with it being an MSc, it's trying to find a research topic that is MSc appropriate. I'm not trying to do a PhD, and I don't know if you work with research students, but I think all of us always want to go off on some kind of PhD level, like I'm going to change the world with my research. So narrowing that down to an MSc level. And I think we all wanted as best that we could try and shy away from a meta-analysis, kind of a deep statistical analysis. So my methodology is a quantitative one. So I counted how many pieces of research have been done. So kind of, and making my inclusion criteria for long COVID that quite broad, any persisting symptoms after the acute infection. And then looking for, so that would be the population, looking for the interventions where that included a nutrition aspect. There wouldn't have been really enough research to make it where it's just a nutrition intervention. And I kind of wanted to know, kind of start that conversation of what are we thinking? How are we making sense of this? So any intervention that involved a nutrition intervention. So when some people might have been rehabilitating in hospital, some people were in outpatients, some people were in primary care, some people were recruited to studies to test a supplement, for example. So I counted the total number of papers where that showed up. I then counted sort of how many different nutrition interventions were done. So was it a dietary one? And if it was a dietary one, did we emphasize protein? Did we emphasize carbohydrates in any way? Were we looking at fats at all? Were there any specific diets? There's quite a lot in the nutrition sphere. There's a lot of, we really like the Mediterranean diet and the Mediterranean approach, but there's lots of other kind of diets as well. So, kind of what knowledge, what wisdom were you drawing from other diets? And then I also looked at the specific nutrients. So are we looking at particular micronutrients, so vitamins and minerals, and maybe other kind of supplements like chemical compounds like our CoQ10. Some people might be aware of CoQ10. It's kind of it's quite a common supplement out there, and we find it in face creams, I think, as well. So kind of what, and plant extracts. So I was really curious, what have people looked at? And so I was counting those and then counting how many times they've been researched. So do they appear just in one study that I found? Have they popped up in multiple studies? So is there a commonality of thinking in how we're approaching this nutritionally?
Yeah, I mean, it's wide sweeping and so many sort of wonderful sources of data points, trying to work out what's been done, how it's being done, perhaps some of the results, exploring all these different diets. I'm sort of on the edge of my seat, to be honest. Like, what did you find, or what were some of the sort of the insights, or maybe even surprising findings, really, from that review?
Yeah. So I found that someone else had looked at this before, a couple of years before me, and they found 5 papers. 2 years later, I found 43.
Okay, yeah.
So that's quite a lot of research activity. So lots of people are asking us this question, kind of, and looking at the dietary and nutritional components that might be able to support recovery in long COVID, recovery and management in long COVID. And I found that there were some themes. So some of the nutritional aspects that original paper found were repeated in further research in the studies that I found. So there is some similarity of thinking, which is nice to see. Kind of what I was looking for is how broad is this research? So how much, kind of how wide net are we going? And then how deep is it? So how many times have we tested it and tested it again to see, does this really work, sort of thing? And I found that it is very broad, not especially deep.
Okay.
And then I also had a little look at the outcomes. So when I was looking at it, did they find a positive result? Did they say, yes, this worked, or this seemed to work, our intervention seemed to work? And I think we sort of know in the research sphere that there is a bias towards publishing positive results more than either finding a neutral or a negative result. I did find some papers that said, you know what, we gave it a try, but actually it didn't seem to do any different. And that might be that is the case, but it also might be they just didn't find an effect because of the way that they did the study. But most of my papers did find a positive result. So it's difficult to say then out of that, what what's the specifics, was still not quite there of, yes, if you've got long COVID, do this, this, and this, take this supplement. We're just not quite there yet.
Mm. Yeah. It's kind of not surprising, is it, I suppose, that there's
Mm.
a breadth of approaches
Mm.
considering the breadth of what the long COVID experience is. And so,
Yeah.
kind of capturing the many and varied ways that people have just tried to be helpful there, nutritionally and probably
Yeah.
otherwise as well, that they've taken various approaches. Positive to
Mm.
hear, though, that
Mm.
on many fronts there are
Mm.
good outcomes or positive outcomes for people, which is very promising. Uh, you work in a long COVID ward, and you primarily
Mm.
do the psychological therapies.
Mm.
But
Mm.
I can imagine your ears pricking up at
Mm.
these possible ways
Oh,
to
definitely.
to bring it in. I mean,
Yeah.
what would you say in terms of how your research and its findings might inform your work supporting people with long COVID, or
Mm.
maybe practical takeaways there for all of us, really, that might be applied in clinical settings?
Yeah. Um, yeah. So I think the potentially safest thing to say, I suppose, when thinking about nutrition, um, I feel like it's important to say, kind of, whilst we're all human beings and we all eat in probably, kind of sometimes similar but also very varying ways, we all have our own biochemistry and we're all made up in a slightly different way. And so I am exceedingly, especially in my psychotherapy NHS job, I'm exceedingly tentative, and don't really. I notice when people are taking certain supplements, but I don't think it would be particularly safe to kind of say everyone should take this supplement.
Mm,
But nutrition approaches, diet approaches, I think it. What I took from my research, one of the key things is that across both diets and then some of the supplements, emphasizing protein is one that seemed to really crop up.
mm,
So, ensuring that we take in adequate protein, and it might be actually in our, particularly our Western diet, that I kind of would probably place myself in. That is entirely possible that in the Western world we maybe not don't quite get enough good quality protein. It's quite a tricky one to kind of to maybe get enough of. And again, kind of drawing from my own personal experience, I did a 12-week PT thing one time, trying to feel a little bit better after being chained to my desk for doing MSc and working practically full time. And there was a nutrition component to that, and the macronutrients that this PT set me was kind of emphasizing protein, because I wanted to build muscle. It's hard. It's hard to increase your protein intake,
okay.
and
Yeah.
I'm a nutritionally conscious person, so kind of just thinking about when making when building a plate. There's some numbers that you can put against, kind of, or percentages about, kind of proportion of protein, carbs, and then the rest of your plant foods. But what I do find quite helpful is using a hand. So a portion of meat might be kind of the size of your palm. And if you're going to want to emphasize your protein intake, maybe you might like to include the knuckles as well. So something just a little bit more, perhaps. And then, a portion of carbohydrate might be like a fist. So it might be the size of a baked potato, or, a kind of a fistful of pasta or something like that, if that's what we eat, or rice or whatever. And then the rest of your plate would be plant food, ideally, in different colors. So you're getting the different colors tells us that there's a variety of vitamins and minerals in there. And when we're getting variety, when it comes to well-being and nutrition, variety very much is the spice of life in
Mm,
all kinds of ways.
mm,
So as best that we can, but of course we have our likes and our dislikes. So taking that in within the boundaries of what we enjoy, because I think, just sort of coming back a little bit maybe to the when sharing this information and trying to sort of nudge people in a way that might kind of benefit their biochemistry, at the center of that for me is always that food is something that should be enjoyable. We should like it. we should enjoy it. Is one of those things that we get to do daily, multiple times a day, and that it should be perhaps emotionally nourishing as well as biochemically nourishing. And that's also going to be a recipe for sustained behavior as well. If we like what we're doing, we're going to want to do it and continue to do it.
Mm.
So yeah, emphasizing protein, I think, is potentially one of them. And if we're finding that difficult, then there may be, kind of a protein shake is something that can be helpful. But I would tend to go food first, as best that we can. So yeah, I think maybe some of the other themes that we saw is where were my so emphasizing our B vitamins are vitamins that are quite key in our biochemical processes for making energy. I sort of see, so people often take maybe like I see people in clinic who maybe are taking a multivitamin, for example, which is not an unreasonable idea. And our other minerals that are particularly key in our making energy, kind of addressing potentially, supporting feeling as energized as the body is able to. It's kind of trying to offer the body the components. The body knows what it wants to do. If we just give it the building blocks, it will do what it needs to with it. And so maybe magnesium and zinc were things, and iron were particular minerals that I was seeing a trend in the literature that these were more commonly cropping up than maybe some others.
Yeah. Okay.
But I think from a diet point of view, just sort of coming back briefly, was if we're eating, kind of our colourful, as best that we can, our colourful plant foods, you're going to hit those.
Right. Yeah. Yeah, you sort of said right at the start today, there are some low-hanging fruit kind of changes that probably apply here as well. There might be certain food choices that we can explore with clients in terms of, caffeine or sugars or, those sorts of things. Then there's just kind of that notion of a balanced diet and some of the nutritional education around all of that. Maybe some of the proteins seems to be, interesting to consider. There's some early research that's kind of, there's a bit of a theme there around all of that. And perhaps the vitamins and minerals, the magnesium, zinc and iron, it's interesting. It's, by the sounds of it, it's still early days-ish, but in the last couple of years, there has been a kind of exponential growth in the research and the interest that people are bringing to nutritional approaches to long COVID.
Yeah, absolutely. And other people are getting really interested in this as well. The fields are getting interested in this. So when we start thinking about the more specific, kind of biochemical and specific nutrients, there's an emergent field called nutritional psychiatry. And as when I was thinking about my own journey, I was thinking, I wonder if I could call myself a nutritional psychotherapist. What would that even mean? But now that there's nutritional psychiatry, I'm very kind of tentative around maybe going down that route. And I would never, I'm not a psychiatrist, so I would never claim that title. But there is this fear of, idea of us almost, kind of using supplements and particular vitamins and minerals, because our neurochemicals are made of proteins. We know, whether it was part of my step 2 training, tryptophan, kind of is a precursor, is an amino acid precursor of serotonin and melatonin. But we would maybe, if someone's on an SSRI, we might want to be a bit cautious about how much tryptophan is in the diet, perhaps, because that could be a more, that can interact, might get too much. There's a problem if we have too much serotonin in the body, which is very difficult to get to. But just the kind of things that when we're working in mental health that we are aware of already. There's a lot of interest in nutrition and diet and mental health. You've got in Australia, Professor Felice Jacka, who's in Melbourne, I think, and doing a lot of research, really leading on a lot of research on more epidemiological epidemiological studies. That's a really tricky
Yes,
one
it
to
is.
say.
You
They're
did
looking
it.
at massive population studies
Yeah.
of influence, kind of what type, the ways that people eat and connect correlations with mental health. And so then nudging that, can we, do we have positive mental health outcomes when we can nudge behaviors in a particular way, coach people to eat in perhaps a somewhat more healthful way, which, kind of in the most basic way to describe that, which is, kind of turning down the number of ultra processed foods, those very shelf stable cakes and biscuits, for example, and crisps, and turning up the quantity of whole foods, fresh whole foods, as best that we can. My mum had a lovely guide that I've carried with me for such a long time, which is, if the food looks closest to what it originally was, it's probably going to do you some good, versus
Mm.
food that, it's made of things that you can't tell what it was before.
Hmm. That does seem to be a good rule of thumb, I suppose,
Yeah.
that we can follow. You've very nicely broadened back out there, and I
Mm.
like how you sort of seem to be thinking of yourself as a psychotherapist and a nutritional therapist. That seems like a really nice way to present this kind of joint combined interest that you have. But yeah, there seems to be something about what we eat and how we care for ourselves. And
Yeah.
as we sort of said early on, our food choices can be kind of an act of self-compassion.
Mm.
How do you see nutrition maybe fitting into that broader picture of compassion and self-compassion?
I feel like the really obvious, what we're thinking about here is the three circles. That's what
Hmm.
certainly comes to my
Okay.
mind with that question. And when I think about the CFT3 emotion regulation circles, I tend to start in that threat place, in the threat circle. And but I suppose it correlates with Maslow's hierarchy of needs, doesn't it? Kind of adequate food, not being hungry, or being hungry is a threat in the body, and
Mm.
kind of psychological and physiologically, and kind of having adequate food is one of our basic needs, and it's something that we see in all life, don't we? All life, even plants, kind of are motivated towards what nourishes them. Sunflowers turn towards the sun. My plant here, because the leaves were going this way, and so I was like, well, if I do you that way, I can encourage you to go stand up straighter again. So we're all motivated towards nutrition. So I've used the word motivation. That makes me think of the blue circle. Our drive to go out, kind of, and as animals, kind of going out into what could be, dangerous environments rather than staying in our nice cozy home. That becomes a threatening place when there's not enough food there. So we've got to go out, got a motivation, drive to go out and gather and collect. And then food itself, kind of the act of eating, it's we mentioned earlier, it's a social thing. It's that sitting around the fire when we're experiencing plenty, when the food is there. I certainly, for me, I notice feeling, it's a really subtle sense of soothing, but I notice feeling soothed. So, and what comes to mind with that one is, I was very recently very fortunate, and privileged to have an adventure trip in Vietnam recently. And one of the things that really struck me was how plentiful it was. You're seeing fields growing plentifully. It's so warm and humid, isn't it? Kind of, it's such. It seems like, anyway, to me, such a lush environment. Food just kind of grows everywhere, and everyone's doing it. And all the stalls are always piled high with food all the time. And it's like, and I always wondered about waste, kind of what happens when the fresh food goes not so great, because we're also in a warm and humid environment. It's like, well, they've got, chickens and pigs and stuff, so nothing actually goes to waste. And they're just so productive. They're able to maintain this. And I think it really gave me a sense of, kind of from that perspective, it's all right here, and people are all right. No one looked hungry, because they had no need to look hungry, so because there was all this plentiful food, and everyone seemed pretty healthy to me, kind of walking around, not very many overweight people, for example, as well. So such a really fresh diet and plentiful of it. And I noticed, with me noticing that, I don't know what it's like to be a Vietnamese living in Vietnam. I've only visited it, but as a visitor seeing that, I was like, I felt relaxed by that, by seeing that. So I think, kind of when we've got, and when we've got our food set, there's a real feeling of feeling settled. And then there's the act of eating, isn't there? We've talked a little bit about that as a compassion act. What do we choose to eat? Where are we at? I've mentioned ultra processed foods today, and I eat ultra processed foods, but not all the time. And I think we mentioned how nourishing ourselves and working with whole foods, it takes work, it takes planning. And so it's really that combination of that drive and that soothe working together to manage that sense of threat of not having not enough food.
Mm. Yeah, that's really great to formulate it around the three circles, and it sort of is in there in so many ways. To be not having availability of food is intensely threat system activating, and drive system really is all about seeking resources such as food and the sort of the pleasure we experience with all of that. And soothing system, yeah, we really evolved to be together and sort of seek the food and eat the food or consume the food together, and that when the threat is gone and our tummies are full, then we're sort of feeling safe and calm and secure and in the soothing system. And what do we do when our babies are distressed or crying? We pick them
Mm.
up and give them some food. So it's
Exactly.
it's it's
Yeah.
sort of in there, although it's complicated. We have tricky brains, I
Yeah.
suppose, because
Yeah.
sometimes food becomes the way that we settle the threat system,
Yeah.
but in a way
Yeah.
that has unintended consequences then,
Yeah.
because
Yeah. Yeah.
it sort of causes other difficulties, and sometimes is the soothing system, but also really just that self-compassionate motivation might be
Yeah.
about how we, just delay the urge perhaps for a little while
Yeah.
longer, in terms
Yeah.
of having that next bit of food. The drive system kind of loves the high sugars or whatever it
Yes.
might
Oh,
be,
absolutely.
and so it's
Yeah.
it's tricky. It's
Yeah.
and
Yeah. I'm
it's
so
about
glad you
balance, I
brought that up.
guess.
Yeah, it really is. I'm so glad you brought that up, because I think that's so important to name, and perhaps might be one of the reasons in some ways why I'm here, why I'm motivated to be here. I'm very fortunate, I would say, to have a very good relationship with food. But exactly what you described there, not everybody does. And I wonder if that could be one of the barriers why nudging nutrition in the way that we've talked about here doesn't happen quite so much. Maybe why that doesn't happen, because it's very easy, especially in our Western culture, in our culture of plenty, where you can go down the supermarket and kind of find all kinds of foods from around the world and these ultra processed foods. And that, this is an economical aspect as well, isn't it? Kind of what can we afford to fill our cupboards with? That
Mm,
can perpetuate quite sometimes a very tricky relationship with food, and at its trickiest end is your eating disorders. But that's not where I'm going, and I know kind of we've got people like lots of experts in that area, but I think we're recognizing that there's also disordered eating rather than an eating disorder. So it's not eating disorder, but it's not a healthy relationship with food either. It's not a good relationship with food. It's maybe it's maybe fearful. What is this food going to do for me? Or kind of in a fearful way, how's this, if I eat this, how's this going to affect my body shape immediately? Which is probably kind of quite a tricky experience to have, because food doesn't affect the body. The food doesn't affect body shape immediately. It's a slow process.
mm,
Um, and things like whether we're driven to clear our plate or not. I've remember conversations at university with people
mm,
who's like, I mustn't finish my plate. I have to stop eating before I've eaten all the food on my plate. and kind of cognitive thoughts, kind of rules and assumptions around that, and or other people saying I have to finish my plate even if I'm served too much, which actually I'll probably fall a little bit more into. I've been exploring that in my own personal life, being like, stop when I feel full and satisfied, not when I finish my plate, and
Mm,
trying to obviously serve myself the right amount of food for that, but
mm.
allowing myself to food waste. Maybe that's a little tricky area for me. I don't like waste
Yes.
too much.
Yeah.
So we all have this, and I think that's food can become incredibly tricky, and the three circles can be incredibly helpful to make sense of that.
Mm.
But that
Yeah.
might be why we don't have these conversations as much as perhaps we could.
Yeah, yeah, that's a really nice little kind of takeaway for me, really, is that, talking about the three circles quite a lot and with clients and so on, but it is interesting to think about how their food choices or diet or, their appetite and the ups and downs of all that might also, map a little bit onto the three circles as well. And you remind me, of course, that we're born with tricky brains that are designed for us and not by us, but we're also shaped by experiences, and so a whole
Yeah.
range of experiences around food and family or culture or generational kind of changes
Mm-hmm.
that or influences there. So there really is a lot to it. I mean, in some ways, from a CFT, compassion focused therapy point of view, we talk about the three flows of compassion. And
Mm-hmm.
I can
Mm-hmm.
imagine that there are ways to think about where food fits across those three
Mm,
flows, whether it be
yeah.
when we're expressing compassion for others or when we're
Mm-hmm.
opening ourselves up to receiving compassion, and then
Mm-hmm.
that self-compassion piece as
Mm-hmm.
well.
Yeah. Yeah. Yeah, absolutely. And you know what comes to mind when you mention that as well is I don't there's certainly especially working in offices. In an office, you notice there's often a feeder, the
Ah,
person who's always bringing food in. I don't know if that's something that you might have noticed in
I have.
where you
Yeah,
worked before. Yeah.
yeah,
So
yes.
there's so much around food, isn't there? It's such a social thing, and we spoke briefly just then about the ideal social of kind of when you're with your safe people and you've had a safe meal and then you're all kind of replete and satisfied and just enjoying time together. But there can be quite a lot of tricky behaviours and rules and assumptions in families and societies around food as well, can't there? That
Mm,
that exactly that we're nurtured by, and how we
mm,
take that forward.
mm.
Um,
Yeah. Yeah, I often share. I did a TEDx talk a couple of years ago, and it was just about my daughter and some of her really difficult health challenges when she was a baby, really, and the way that also, kind of affected us or me, and one of the things that happened for her was that she wasn't able to eat food,
oh
kind of
gosh, yeah,
orally.
yeah.
So she's on,
Mm,
parenteral nutrition. It's all in the
mm,
TEDx talk. She's given me permission to
mm.
to talk about it. But I just
Brilliant.
remember this one moment where I was really off my food myself, and I
Mm,
didn't
mm.
didn't really feel like it, but also
Yeah.
didn't feel like I should, or given
Right.
what my daughter was going through, there was a weird feeling of,
Mm.
like I probably shouldn't, I don't deserve to eat either, and my dear mother sort of came into the hospital to visit and so on, and out of care and concern and compassion, she brought in a little chocolate milk
Oh,
and
does she?
um,
Yeah,
and
lovely.
sort of said, hey, how about you just have a bit of this, just to
Yeah.
got to look after yourself,
Mm,
keep yourself going, and that sort of stuff. And it was
mm,
just a really well, it did. This is literally 20 odd years ago, and it stuck in my
mm,
mind, sort of thing, because
mm,
it was such a powerful act of compassion from her, but it was
mm,
also a challenge for me to open myself up
mm,
to receiving that compassion as well. And then, of course,
mm,
gradually turning compassion towards myself to kind of, gradually get through everything, which we did, and
mm,
it's all sort of a
mm.
good ending. But that's a kind of, I don't know, I just
Yeah.
wondered your thoughts there, or whether you've come across similar examples where nutrition really is a vehicle for compassion.
I wonder if, yeah, as a vehicle for compassion, that's so lovely.
Yeah.
Because food is, like we said before, food is something that we do every day, multiple times a day. We eat
Mm.
every day, multiple times a day, and it's a very physical giving, isn't it? But there can be so much compassion infused in that. So, something that
Mm.
comes to mind, and it's going to sound a little bit like I'm tooting my own horn here, and I
Mm.
don't, I don't mean
That's
to sound
okay.
in this way. But one of the things that comes to mind is, I've got a couple of examples that I had a friend who lived around the corner from me, and she told me that she was feeling really, really rotten with a really horrible cold. And this was pre-COVID times. But I was already down, kind of my own, kind of nutritionist food kind of journey. And I can't remember exactly why I felt concerned. Well, concern is obviously I was moved by her suffering.
Yeah.
Anyway, the short story being that I made her a chicken soup.
Mm.
And so when I just went out to the shop and I got some chicken wings and some chicken drumsticks. So chicken with the bones on and cartilage, and I think I had a pressure cooker, so I pressure cooked it, so it gets all the good nutrients out of the bones, and it's quite, kind of more, the leg is, maybe it's got a bit more nutritiously dense meat to it than perhaps the breast,
Mm.
um, and makes a really, kind of good, healthy fats nourishing broth with the bones from it. So, and I would have pulled the bones out, I think, and then putting in some onion and some carrots, and just making this
Yum.
wholesome soup. Yeah. And I think a lot of cultures have this kind of soup. I was chatting with another a colleague one time, and he's from Liverpool, and they have scouse, I think, that they make,
Oh,
and
yes.
and in Bahamas they have sous, which is the same but a bit spicy, that I've had as part of a hangover.
Oh.
So actually my friend's partner at the time went out and got sous for us all because we were all feeling rotten with a hangover.
Yeah.
So then I wasn't able to stop with my friends, but I made this overnight, went round the next morning, and I dropped it on at a door, knocked on the door, and then had to go to work and just dropped this chicken soup round because I was moved by her suffering, and I knew that this would be easy and nourishing for her.
Yep.
Whether it had kind of an impact on her, the course of her illness, but I think kind of that she was really moved by that, and I loved doing it. That was a skill. It was something that I knew that I had to
Yeah.
offer, and I had the time.
Yeah. No, and
And
if
then
we,
perhaps this, yeah,
oh, sorry, if we think
that's,
about the
yeah,
yeah, just the definition of compassion. It's that
mm,
sensitivity to the suffering, and then taking
yeah,
some sort of helpful action. And I think there
yeah,
can, food definitely can be a vehicle for compassion in that way. And I was thinking, as that a particular incident occurred before COVID, but there was some research I was involved with, mainly led by Marcela Matos and a number of others around the world, and it was found that in fact compassion increased over COVID, and
mm, mm,
and I do remember that one of the things that we would all do is we would drop things off to people when they were
yeah,
quarantined at home because of COVID, and
yeah,
drop off meals, specifically.
absolutely.
So it is a beautiful example of how all this might fit together.
Yeah. And people do it when with new couples, don't they? With newborns as well. And kind of, I'll make you let's freeze batch a bunch of food for you. There you go, and you don't have to think about it. We know that you're sleepless and doing your best.
Mm.
And even there was a TV advert which was exactly that. Was it, kind of, someone lived next door to a couple that just had a baby, and it was crying all the time and through the night, and the neighbor knocked on. So you're seeing this advert, I can't remember what it's advert for, but the neighbor sort of is noticing the sound, rolling their eyes perhaps a little bit. So with they're building one narrative, and then the neighbor knocks on, and the couple are like, I'm so sorry, she just won't go to sleep, sort of thing. And she's like, I'm not here to complain, I've made you some food, you must be exhausted.
Right. Yeah.
And I can't remember what that was advertising, but kind of this giving of food, the noticing suffering, and then the offering. It's actually it's really quite a natural, authentic thing that we do, isn't it?
Yeah. It is.
I think you're getting me to realise in this moment actually that perhaps when I'm doing CFT, that maybe when we're doing the flows of compassion, it's something that I might integrate, kind of
Mm,
that flowing compassion, the gifting and receiving food is such a tangible compassion act experience, isn't it? Yeah, I think
mm,
there's a real,
yeah.
real room for that.
Chicken soup for the soul type thing, as they
Yes.
say. So,
Is
all
that
right.
going to be
Well,
the title of my book?
yeah, there you go. Jen Dorban, I really do appreciate you coming and chatting with me. What's next for you in maybe in terms of research or maybe also just in terms of
Mm.
your thinking about psychotherapy and nutritional therapy and compassion and self-compassion?
Yeah, thank you. Lovely question. So, research-wise, I'm currently working on seeing about getting my write-up published.
Great.
So, fingers crossed for that in the near future. I've had a lovely couple of opportunities to talk about it and presented it at a conference. I would love to carry on doing research. It's really difficult. I don't know if it's the same in your sphere, but it's quite difficult being an active clinician and a researcher. I feel like people
Yeah.
seem to go down one path or the other. So I don't have any current plans for further research, although I have a drive for it. It's just the opportunity. See if we can create that. Um, and then clinic wise, I'm really excited to explore my who I'm going to be as a nutritional therapist. So because this is such a new skill for me, and that one that compared to I've been working in mental health and delivering kind of comment working with anxiety and depression etc. for 10 years now, which is quite amazing to kind of think how that time has accrued. And I'm not even 1 year old as a nutritional therapist.
Mm.
So my intention is to start out keeping them a little bit more separate at first, the kind of the more in depth, because nutritional therapy can go such in depth and into that almost. We talked about nutritional psychiatry sphere, kind of how we can really support things through the nuts and bolts, that personal oriented and really emphasizing personal oriented. We're all different. We all absorb nutrients in a different way for different reasons. And this is what nutritional therapy gets into. It's like, how can I help myself feel my best self? And I'm really passionate about that because I think a lot of us don't realize how good we could feel potentially through perhaps some of the common habits that we're making.
Mm.
Um, and But then, yeah, I think you've given me a lot of wonderful food for thought here. I'm going to continue, kind of including those nudges and that awareness and the flows of nutrition and giving and sharing food. I think is going to continue to be quite integral part of the way that I work, as presents to me in that very collaborative relationship. So if it
Yeah.
seems like that's a part of the formulation that work that fits with that client, then yeah, I'm excited to go down there. And through that, I would like to, I was already noodling on an idea of a workshop. How can I kind of
Great
offer
idea.
through my experience and case
Yeah.
studies, kind of that confidence to my psychological therapy peers to use some of this in a safe way.
Yeah.
This because I think that we can, and maybe I can bring my psychotherapy and behavior change side to the nutritional therapy sphere, and maybe do some behavior change workshops and psychological mindedness in nutritional therapy side as well. So these are the big ideas that I've got,
Mm.
that I look forward to building on.
Well, nutritional compassion or compassionate nutrition, but whatever it is,
Oh
you're
yeah,
doing excellent work in this area. Fascinating stuff. Jen Dorban, thank you very much for being on Compassion in a T-shirt.
thank you, Stan. It's been an absolute delight to be here today.
Great.